good morning to all. I am Prof.Manavalam. Today we are going to see about the types of abortion. Everyone knows very well the pregnancy is a joyful journey. During this journey, it takes place 40 weeks of time period. Not only the mother experiencing the joyful thing, at the same time, mother may encounter unwanted experience also. Some of this experience that may leads to fetal and maternal complication, and that one of the antenatal complication is called as a abortion. It is a life-threatening complication of the disease to the fetus mainly, and also it causes some of the problem to the mother as well as. Let us see the definition of abortion. Abortion is nothing but it is an expulsion or extraction of the embryo or fetus from its mother, its weighing 500 gram or lesser than that, when it is not capable of independent survival. This definition was given by WHO. This 500 gram fetal development mainly attained approximately at 22 weeks of pregnancy. It comes around 154 days of gestation. The expelled embryo or fetus is called as a abortus. The word abortion is the recommended terminology for spontaneous miscarriage. Next, move on to the types of abortion. There are two types of abortion, spontaneous and induced. Spontaneous abortion is as occurring spontaneously without causing any induction. But induced, it is deliberately induced by the aspiration or by the mother themselves. So first we will see about the spontaneous abortion. Again, it is classified into isolated and recurrent abortion. Further, this isolated and recurrent abortion, further it is classified into threatened, inevitable, complete, incomplete, missed and septic abortion. Next, move on to the induced abortion. It may be a legal abortion or illegal abortion that considered as unsafe to the mother. Next, move on to the spontaneous abortion. Already we have seen there are different types of spontaneous or classification of spontaneous abortion. In that first one is threatened abortion. Name itself, it has the meaning threatening. Yes, it is definitely threatening the mother as well as the caregiver, whether the fetus is surviving or not. They are having the state of confusion. So the definition of threatened abortion is a clinical entity where the process of abortion has been started but it doesn't progress to a state from which the recovery is impossible. So the process of abortion is starting but it is not progressing the further. So there is a higher chance of survival of the fetus in this condition if we are providing the proper management to the mother. In this, the mother commonly used to have the abdominal pain and bleeding. Most commonly occur before first 20 weeks of gestation. In this case, while examining, cervical os most probably closed. No passage of the fetal tissue through the cervical os. Second one is inevitable abortion. Inevitable abortion means here the process of abortion has started and it is entered to the progress from where the continuation of pregnancy is not at all possible. So the fetal survival is not possible in this type of abortion. Here again the mother have the abdominal pain and bleeding. Cervical os is getting open in inevitable abortion, but the fetal tissue which will not be coming out. We have to induce the abortion to take out the fetal products out. Next, incomplete. Incomplete means the entire product of conception it is not coming out. Certain amount of are retained inside the uterine cavity is cause for further infection. That is called as a incomplete. Again here the mother experiencing abdominal pain, bleeding, cervical os while examination is opening. Some product of conception still remain inside the uterus. Some of the products it will be expelled out. Complete. Here completely the product expelled out from the uterine cavity through the cervical os. The mother used to have the same symptoms, os are closed, but complete passage of fetal parts and placenta which will be present. So after comes out, it will be getting closed os. the uterus is contracting like a normal delivery. Next is septic abortion. Septic abortion, it has happening because of the mother is showing the abortion. It is one type of abortion, but the mother is showing the clinical evidence of infection like fever, chills, means that is called as a septic abortion. So most common cause of septic abortion is staphylococcus, and also the common reason of developing septic abortion is illegal abortion. Here, the cervical was open with purulent vaginal cervical discharge which will be present while examining the uterine field tenderness. So here the passage of product sometimes may be none, sometimes may be incomplete. Some of the product which will be coming out, some of the product which will be remain inside the uterine cavity. That's all about the spontaneous abortion. Apart from that, one more abortion is there, that is recurrent abortion. So consecutively the mother is having 2 or more abortions. Spontaneous abortion means that is called as a recurrent abortion. The reason may be the genetic. Move on to the induced abortion. It is further classified into legal abortion and illegal abortion. Legal abortion means the continuation of pregnancy may be high risk to the mother as well as the fetus, means legally it is acceptable. Their mothers are undergoing to termination of the pregnancy, means that is in a hospital setting, that is called as a legal abortion. In this type of abortion, there is a less chance of infection or sepsis or whatever may be the complication, very less in this type of abortion. Second, move on to the illegal abortion. Illegal abortion means the mother who had pregnancy because of unwed or the mother had unwanted pregnancy, they have to terminate their pregnancy without going for the legal procedure, means it is end up with illegal. They will take their own medication without undergoing any ultrasound examination or further further investigation. Most of this kind of abortion, it is end up with some type of infection and sepsis to the uterus. So this is about the 2 types of induced abortion. I think everyone understand clear about the what is abortion, what are the different types of abortion. So which one is considered as a safe? If their mother is undergoing legally, means it is one kind of safer one. If the mother is undergoing the abortion illegally, if the pregnancy is unwanted, means most of the it will end up with sepsis. So everyone clearly understood the abortion, I think so. Thank you all.